can having PAH cause lower oxygen saturation levels?
One of the things that I talk to my patients about when it comes to oxygen is that most essential is that if we find that our patients require oxygen so that their oxygen levels continue to be above 88%, that they should use it because we know that keeping ourselves in sort of a normal oxygen level will help offload how hard the heart has to work. It will keep the blood vessels in the lungs open and not as narrowed. But the question really is, can having PAH cause lower oxygen saturation levels? And it's a really great question because not every patient with PAH will require oxygen. But we know that with the blood vessels, when they become thickened and more narrow, it's very difficult for oxygen molecules to travel from the tissue of the lung through the blood vessel wall and into the blood, where it can then be distributed to the body. So often, our patients do require oxygen because their ability to absorb and exchange oxygen and carbon dioxide is decreased. So I think this would be the aspect where talking to your provider, I often am getting oxygen levels, not just when you come into my clinic and are sitting at rest after you've had a chance to take some nice deep breaths. I want to know what it might look like every day. So we do the 6-minute walk test and we evaluate what someone's oxygen level is doing while they are walking and exercising. I often am getting an oxygen level while they're asleep at nighttime, called a nocturnal oxygen saturation, making sure that when they're awake during the day, they might be okay, but for 6 to 10 hours at night while they're in bed and asleep, they may have low oxygen. So, those would be areas to consider when it comes to oxygen needs.